Welcome, everyone. Thank you for joining. We've reached our start time. All participants have been muted today. This meeting is being recorded, and the recording will go out after the meeting. Check out our attachments pod for the slides from today's meeting. This presentation was made possible by the Preschool Development Grant Birth through 5 initiative from the Office of Child Care, Administration for Children and Families, U.S. Department of Health and Human Services, and the U.S. Department of Education. We're excited to talk a little more today about the CDC's Learn the Signs, developmental screening. And for now, I'm going to turn this over to Jim Lesko.
Thank you, Evelyn. Appreciate that. Thanks for getting us started. So I am excited to have an opportunity to start this presentation today. And it's the CDC's Learn the Signs, Act Early, a developmental screening community of conversation. So again, my name is Jim Lesko. I'm the Director for Atlas Research, Preschool Development Grant Birth to 5 Technical Assistance Project. Today, we have opened this opportunity to invited participants, which are PDG B-5 grantees, plus their partners and their consultants. The PDG Birth to 5 Technical Assistance team has also joined the conversation today. We've opened this conversation to the federal project officers and regional office representatives linked with the PDG Birth to 5 regions and states, as well as our PDG Birth to 5 Technical Assistance partners, such as the State Capacity Building Center. We always like to remind all of our participants and grantees that this is a voluntary participation conversation. We have select presentations and resources available on a PDG B-5 website that's linked to the Office of Child Care Technical Assistance site on the web. We have a listing of all of our recordings and slide decks and closed caption transcripts from each of our recordings. This is an open conversation, though the lines, as Evelyn mentioned, are muted. We do encourage you to ask questions of the presenters in the chat box. Both presenters as well as those managing the webinar today can see your questions, and we'll do our best to get to them before the end of the conversation. So it's my pleasure to turn the conversation over to Julia Abercrombie, and I know that she's pulled together a terrific team of folks who are directly on the line working with the developmental screening process in our preschool development birth to 5 states. So Julie, it's yours.
Sure. Can everyone hear me okay?
Yes.
Yeah. Okay, wonderful. Thanks. So it is really my pleasure to be here with you all today, and we're really so grateful to have this time with you and really grateful for the work that you've been accomplishing through PDG for children and families in our communities. So today, as Jim mentioned, we're going to provide information on how you can enhance developmental screening and encourage developmental monitoring through our resources. And I think what will be especially helpful for you today is hearing from our ambassadors and a PDG state partner about how they're going about this. So my role is to quickly provide some background before our state examples, and as part of that, I want to refresh our awareness of the importance of early identification of developmental delays and disabilities. And I'm going to do this by showing you some statistics that are hopefully not new for you. As you can see here, about 1 in 6 children has a developmental disability, and so more common than people realize, and why screening and monitoring are so important. 1 in 4 are at risk for developmental, behavioral, or social delay. And then in addition, from CDC data, we see that 1 in 59 children has an autism spectrum disorder. And we know that most children who are identified with autism have a developmental concern in their evaluation records noted before the age of 2 years. However, the median age of diagnosis is still around 4 years. So we know we want children to be identified earlier because we want them to access early intervention services, which we know are effective. And hopefully through PDG, you've been able to work more intentionally with your Part C and preschool special education partners. So today you're going to hear us talking about both developmental screening and developmental monitoring. Developmental screening is our focus today, and it uses a validated screening tool, and I know most of you are familiar with the ASQ, Ages and Stages questionnaire. Developmental monitoring, on the other hand, is an informal practice of being aware of and observing and tracking developmental milestones, often with a checklist. And the Learn the Signs Act Early materials and checklists are tools designed for developmental monitoring and not a replacement for screening. So I want to be very clear about that. Our materials are designed to complement and prompt families to have that developmental and autism screen on schedule or any time that they have a concern. I thought that you would be interested in seeing some of the data we have available at the national level on developmental screening. So from the National Survey of Children's Health in 2016, the figure of about 30% of parents reporting that they completed a questionnaire about development in the last year. And then from Medicaid administrative data, we see that a median of 40% of children on Medicaid from the 27 states who reported were screened in the last year. And then finally, the third point I wanted to make with these data are just that provider reports of who's screening varies really widely. So there was a recent survey showing about 16% of child care providers to another survey of pediatricians showing about 82%. So the bottom line is that we know it varies, and who's reporting that they're screening definitely varies. And we know that there's also many strategies that are being implemented by states to increase screening. So I know you're maybe familiar with work through QRIS and other quality improvement initiatives. And of course, many of you saw PDG as an opportunity to advance screening. When the original initial PDG applications came out, a colleague and I reviewed all of them. And according to our tally, we saw that 16 of the applications specifically mentioned that they wanted to use these funds for developmental screening. And then there were other mentions of improving monitoring, referral, and expanding Help Me Grow and relationships. So that was very exciting to see. And I hope that many of you are already familiar with Learn the Signs, Act Early. The goal of our program being to improve early identification, and our resources do support developmental screening in a number of ways. So for example, if families are using the Milestone Tracker app, which is showed right in the middle of the screen here, they will receive notifications right on their phone about asking their providers for developmental screening when their child is at an age to receive that screening per the AAP recommendations. And we also have fact sheets that explain what developmental screening is to families and why it's important, training for early educators, and much more. So you can check out all of our resources on these links. So you can just go to cdc.gov/actearly/materials. And on this slide, you can access a list of some of the languages that we have available. All of our materials are copyright free and able to be reproduced and customized as you see fit. And I wanted to quickly mention the Birth to 5 Watch Me Thrive Screening Initiative resources are still available on the Department of Education website, and updated versions are now on the Help Me Grow national website. So please look into these resources if you haven't already. These were products that many federal agencies came together to create, and they're very useful. So the first goal for when you leave this webinar today is to know who your Act Early ambassador is, and you can find them on this website link that's up here. So Actorly Ambassadors are individuals that we fund through a partnership with the Association of University Centers on Disabilities, and they serve as a state or territory point of contact for our program and are an excellent partner for you. They do receive a very small stipend from us, but they achieve so much more because they're passionate about helping families. So we now have 54 of them now in most states and some territories. And you're going to hear from some of them right now. So I'm excited to first hear from Tish, our ambassador from Alabama, and we're going to go in alphabetical order from there. First, I'm just going to put up my email briefly, so you can reach out to me if you'd like, jabercrombie@cdc.gov. So Tish?
Hi, can you hear me?
Take it away.
Can you hear me?
Yes, I can.
Okay, great. Wanted to make sure. Okay. Hello, everybody from Alabama. I wanted to be able to share on our PDG grant how it is that we are working in collaboration with a lot of systems, but I thought it was important to share with you, first and foremost, that our Alabama Department of Early Childhood Education is the state system that has been awarded the PDG grant, and I work at the Alabama Partnership for Children, and we have a wonderful collaboration with the Alabama Department of Early Childhood Education. Out here at APC, we have two programs that I work with that I am able to do my ambassador work connected through both of these. And the first one is Strengthening Families, and the second one is Help Me Grow Alabama. It is important that in the Strengthening Families, as I work with our Department of Early Childhood Education and our Child Abuse and Neglect Prevention, that the CDC's program for Learn, Signs, Act Early is actually embedded in those. So it makes it easy for me to be able to share these two programs. Help Me Grow Alabama is actually housed here in the office, and we work real close with them in all of the activities in which they do around screening, and we are able to share all of our CDC Learn, Sign, Act Early materials anytime they have an event, and they are also sharing those throughout as they do their events. I want to be able to also say, which I think is just wonderful for us, but our Department of Early Childhood Education, we are big with our first-class pre-K programs here in the state, and we have literally over 1,000 classrooms, and every one of those classrooms are required to do the Protective Factors online training. And another thing is that same early childhood education requires that all of the first-class pre-K classrooms utilize the Help Me Grow Alabama ASQ enterprise system. They have to do that on all of the children, and that information is put into the system that gives us a lot of wonderful data, but the biggest part is that it connects them to all of the resources once a concern has been identified. In those classrooms, as they receive materials from Learn, Signs, Act Early, the developmental milestones, it reaches into a family and then spreads, which I think is very significant on some of the success that we've had and a true partnership within this grant. I also wanted to share that some of the Help Me Grow programs that we have reach out into home visitation, Head Start, early Head Start. We have several pediatricians who have come on board and are actually doing the ASQ therein as a part of their visits with their children. For program continuity, we plan to continue to do assessments as we can, not only within the first class pre-K, but like I said, we have other activities and events where we're able to do and provide to parents an opportunity to screen, but also an opportunity for parents to learn about the developmental milestones where they are able to get those materials and take them home, look over them, and have access to any resources that they might have. Also, has these developmental milestones, our booklets, are distributed all over the state. And I like saying that anytime we go into a program where we're training home visitors or we're training some of the classroom teachers or Head Start or early Head Start, it is wonderful to go in and say that these CDC materials are all free in lots of different languages. Makes it real easy to be able to present that and have it available to those individuals. Some of the things that we are also trying to do is our Help Me Grow database. And this database is a wonderful way to track not only children and as they do the ASQ, but it's also important that because we assign them care coordinators, if there's a need that's been identified, then we're able to track services that those children are receiving. We're also able to pull together whenever services are not available in one area that perhaps we can get them services where they're not available. I want to be able to say, again, we have a wonderful collaborative effort here in Alabama. I work so close with our Help Me Grow Alabama that whenever one of us gets invited to go in and present or to talk or to exhibit the materials for one, we always take the other with us. And I think that's such an important piece to be able to continue in care coordination for families. One of the things that we also think as we start talking about some of the accomplishments that we've had, we have been able to go across the board with so many different state systems that are all doing things for children between the ages of prenatal and 5, and actually now 8 for some of our programs. But to mention just a few of those, we have early intervention that we work real close with, special ed departments. We have programs that are First 5 Alabama. We have several things that are with the Alabama Department of Mental Health. Up until the end of this month, we have been a project launch state, and that has given us some opportunities to also have some resources to take statewide for many of our families. A lot of the work that I do under Strengthening Families, so I work with parents the majority of my time. And I think it's important for you to be able to know some of the ways that we are sharing the developmental monitoring materials that we have available. And one of those is that anytime I go out and speak about strengthening families, I share our materials on developmental milestones. It's important that parents understand developmental milestones. We also have a wonderful tool that we call the Parenting Kit, which is distributed by many different agencies, but more important, birthing hospitals. And those hospitals provide this kit. And in the kit is a wonderful handbook that has all sort of state resources that are available. But it definitely has the materials from all the developmental milestones and ways that the parent can actually access those materials. And we've recently turned that handbook into an app, and I'm real happy to say that Learn Signs Act Early is a part of that, as well as the CDC with many of their materials and all of the partners across the state and the state systems that we have. As my time gets limited, we share materials and also try very hard to help families understand where it is that they can go to get the materials from the CDC. And as we do this in connection with our home visiting programs, our HIPPY, our Head Start, our early Head Start, but especially our first class pre-K classrooms, that we are able to get these materials to the teachers. The teachers are able to distribute them as they need to, and we provide for them as much as we can and as much help as we can to be able to give those materials to them. I also want to share that some of the things that I think are really successes for us is that we do have a lot of doctors across the state who are now using some form of screening, mostly the ASQ, but those materials that I provide for the developmental milestones, the brochures and the booklets and the flyers, they are all there and made ready and available for them. We have a lot of different collaborative efforts that are going across the state right now, and being able to give those materials out. And I want to say we are in many different systems. I know I mentioned the early childhood, but that's because they got the grant, and that's where this grant sits. But we also provide it to our Department of Human Resources. We give it to all of our Head Start programs. We give it to our public health. Our WIC offices are starting to be able to take some of those materials and use them. We have it with our many different health departments. So it's growing. It's growing. And our Help Me Grow is just a tremendous partner, as we literally do so much work together with them. We always go after success strategies and want to mention those. And some of the ways that we do that is because of this grant, I am able to go across the board and work with a lot of different systems that we've had and provide a lot of training specifically on Learn the Signs Act early and trying to help the different social workers and so forth understand the difference in the monitoring and screening and how we can best help to get parents to understand at a simple level. We are regionally across the state. I literally drop materials off in all 67 counties, and we are working with people at all levels. So with that, I want to say thank you. I hope I've helped a little bit in sharing how we work and partner with early childhood education and all of those involved in our PDG B-5 grant in Alabama.
Thanks, Tish. Good morning. My name is Carmen Wenger, and I'm here today in the capacity of the state lead for Help Me Grow Alaska and as Alaska's Act Early Ambassador. I will be speaking from my experience in these roles today and will not be able to represent all work being done through the PDG or viewpoints that exist in the state on developmental screening in the 8 minutes I have with you today. In Alaska, the primary section covering developmental screening in the Preschool Development Grant is Activity 3, Maximizing Parental Choice and Knowledge. My content area for this section includes 3 pieces: expansion of Help Me Grow Alaska outreach, work towards defining a statewide data structure, and creating training opportunities appropriate to Alaska's current screening landscape. Help Me Grow Alaska is a relatively young system, but it's open to families statewide and is structured around the 5 Strengthening Families Protective Factors, with a major focus on increasing families' knowledge of parenting and child development. We first launched the system in partnership with the Early Childhood Comprehensive System in 3 regions, and from what we learned in those communities, we've continued to expand our services. While we serve families prenatally through age 26, the majority of our calls are focused on children 0 to 3 with questions or concerns about their child's development. And there's been a strong focus as we've developed Help Me Grow Alaska on providing both programmatic and systematic support for developmental screening in the state. Help Me Grow Alaska programmatically supports screening through broad-based education on the importance of developmental monitoring and screening, as well as increasing demand for screening through knowledge of child development. This is done through outreach as well as through our care coordination program. We are so happy to partner with the Learn the Signs Act Early campaign to offer high-quality, relevant tools to families and programs we work with. Similarly to Alabama, we have the materials embedded in our system, which makes it easy to share the tools across the state and to help our partner programs know which tools might be the best in their setting. We also work to increase the capacity for screening within the primary care setting for child health care providers through education and access to ASQ3 and ASQ SE2 online tools if the clinic feels they have the capacity to screen but have had a barrier of lack of a standardized validated tool. Finally, we do offer directly screenings to families, either online or on paper, if a child has not received an appropriate screening in another location. Our main goals around developmental screening, however, are at the systems level. We work individually with many partners in screening to make sure we're not duplicating efforts and that we get a better idea of priorities and barriers. Some of the partners include our Part C early intervention, the ECCS system, and maternal child health Title V, as well as early learning partners such as the Child Care Resource and Referral Agency and the QRIS system. Our first effort to support multi-agency coordination was in the fall of 2017 by completing an environmental scan on screening in the state on behalf of the Governor's Council on Disabilities and Special Education's Task Force on Universal Developmental Screening. This group has been the primary focal point in recent years for the discussion around how to achieve universal developmental screening. And while many good discussions and ideas have come out of the work of the group, there hasn't been the dedicated time and support to gather the data needed to make informed decisions to take actions on the group's priorities. Help Me Grow Alaska is trying to use funds available through the Preschool Development Grant to advance some of this work. The stated long-term goal of the task force is to develop and implement a sustainable, cost-effective, and efficient method for universal developmental screening in Alaska. We are able to utilize PDG funds for a data structure plan, taking into account how online screening tool data is currently used by different stakeholders, what they are not able to do with the systems currently in place, and what their reporting or patient care use cases require for their needs to be met. This is being looked at alongside the data system options that are realistic for a current project in our state, including potential ways to restructure how ASQ Online is used to be more efficient and cost-effective while retaining the pieces important to our users, or potentially other platforms that have the ability to combine screening data across tools and electronic health systems. Our final piece of the PDG program is focused on training. And we started with initial planning around training involving use of standard training models that are in use in our state in a limited capacity right now. However, we very quickly saw that bringing that to scale in Alaska had many obstacles. One barrier is the sheer geographic size and remoteness of our state. As you can see from the map, our state runs approximately the length and nearly the height of the continental US, with only a little over 1,000 highway miles. This means that traditional face-to-face trainings are extremely expensive and difficult to expand to a broad audience. As we work to expand to a mixed delivery system, we wanted to find a model that would better reach potential screeners with limited capacity for travel or for taking time off work for trainings, especially people in the early learning setting. There's also tremendous diversity in Alaska. The Anchorage School District, being home to the most diverse elementary, middle, and high schools in the country, serves children speaking over 110 languages. Also, statewide, over half the population under the age of 1 belongs to a minority group. This means that to ensure those in our community providing and interpreting developmental screening need to understand the context in which the children they screen live. In a project that predated the PDG award, Help Me Grow Alaska partnered with Learn the Science Act Early, as well as the LEN program, to work on increasing the cultural functionality of developmental monitoring tools available to families. This started with a project in the Norton Sound region in Northwest Alaska. There was a great deal of interest in more culturally adapted screening tool, but because we do not have the capacity or the funding, either the funding or population size to norm a standardized and validated tool, we decided to start with monitoring information to help educate families about developmental milestones. Our goal is to complete similar projects in at least 2 additional regions. And what we learn through this process is helping us think more inclusively about the way we develop training, especially in relation to sections on talking with parents or caregivers while discussing the importance of screening and interpreting results. So how we've updated our plans for training. We are currently in the process of identifying a platform for trainings and developing content. Priority areas for learning objectives were identified through the spring meeting of the Universal Developmental Screening Task Force in collaboration with the QRIS system. Our goal is to adopt or create 2 to 3 modules that include core competencies of, first, understanding developmental milestones, including what is monitoring and what is screening and why are they important. Second, what does screening look like in Alaska and where does it happen? And finally, practical information about how to talk with parents and understand appropriate follow-up once the screening is complete. The goal of this project is to have the training packages to be asynchronous and online to meet the demands of people needing to be trained and to meet the cultural relevance and the distance delivery needs of our state. One tool that is being considered for adoption to meet the first set of core competencies is the Watch Me training through the Learn the Science Act Early campaign. And currently our plan is to develop content internally for the other 2 competency areas. I appreciate the chance to talk with you today. We are still in the thick of much of this work, but I'm happy to share the progress we've made. And if there's time at the end of all the presentations, I'm happy to answer any questions.
Hi, my name is Jen Doris, and I am the ambassador for the state of New Hampshire. With the Learn the Signs Act Early Ambassador Program, I have been a part of the New Hampshire Preschool Development Grant from the very beginning. It was awarded to the University of New Hampshire, which has our AUCD LEND program. We have been incorporated into that LEND program for the past 3 years that I've been here with the state, and I was also a LEND participant prior to that. I've been involved with Spark New Hampshire, which is the Early Advisory Committee for the state of New Hampshire, which is our governor appointment. As far as the developmental screenings implementation within the PDG grant, our state had decided to do a needs assessment with multiple components. There was a parent focus group, parent surveys, workforce development, as well as interviews for families as well as for professionals in different divisions within the state of New Hampshire to gather information on what were the needs across the state of New Hampshire for early childhood, but we embedded questions regarding developmental screening to figure out what the needs and demands were within our state. Out of those discussions, some of the things that have happened as a result of that, we have created a data discussion group across state departments, and UNH is supporting us in that piece. We are involved in the strategic plan in which we are embedding developmental screening across all areas because it continues to come up as a need regardless of what topic we have been speaking about. There are also monthly stakeholder update calls to review the surveys and gather the information on the needs assessment to identify the gaps, and we are making sure that developmental screening is a primary focus, as well as children with special health conditions and family-centered early supports and services, as those are the hats that I wear within the state of New Hampshire. For leadership on developmental screening, we have it housed here at the Department of Health and Human Services. I am a part of a division called Special Medical Services. We utilize the MCH Title V block grant funding to fund some of developmental screening, as well as our Part C Family-Centered Early Supports and Services, and Head Start Early Head Start funding also assists with providing the basis for developmental screening. It is a severely underfunded system, so we are trying to embed it across systems throughout the early childhood field in New Hampshire. The Learn the Signs Act Early Ambassador funds that they spoke about, those small stipends that we received, are used only for materials for distribution across the system at this point. In New Hampshire, screenings have occurred in a very specific way. Our system started in 2009, and it was really to focus on educating parents, making sure that screening is occurring using the ages and stages questionnaires and social emotional questionnaires. It was focused initially on primary care providers, which, as many of you know, are very challenging to engage in trainings and making sure that we are using a unified data system. So the focus had then switched over to child care to make sure that we were meeting majority of the places where our children are housed within our state. This past year, we have been able to implement a WIC monitoring program, so that will be expanding and growing across the state, and we're hoping that the PDG grant will be able to help support some of that. Learn the Signs Act early materials are offered to all families and are available to, as Tish and Carmen had also mentioned, they're embedded into multiple areas that are receiving screening or providing screening so that we can educate families with some consistent materials. Data is collected in a database called Welligent for child care providers, and so that's kind of how we pull the data on how many kids have been screened across the state. Medical providers are billing for Medicaid, and those numbers are not as accurate as we would like because we're not able to differentiate if they've already been added into the Welligent system or not. We're also missing some information on private insurance billings for screenings. So the numbers continue to be a challenge to gather how many children in the state of New Hampshire are being screened and how often. New Hampshire Medicaid is only reimbursing $5 per screener. We conducted an assessment for primary care providers, child care providers, and others that were doing developmental screening, and many of our sites were saying that they weren't aware of how to bill for screenings or what codes to be able to use. So we are in the process of being able to develop some e-learning opportunities to address those. Some of the barriers for screening in New Hampshire, we have a comprehensive system. We are not hearing from families that they're being over-screened. New Hampshire Family Voices is an organization that we contract with, that we work very closely with. They do a lot of our reports for families, and they're telling us that the feedback that they were getting through the focus groups for the needs assessment were stating that families aren't always aware that they're even being screened, particularly at a doctor's office. Oftentimes they're confusing screening with evaluation or diagnosis. They don't always understand the language that we're using. As you know, Julia had talked about the difference between monitoring and screening and assessment. Oftentimes our families get that language confused. And so our developmental screening system in New Hampshire is currently relying on families to inform people that they've already had their child screened or having that conversation with a primary care provider. The data systems that we have, unlike the ones that I was hearing about in Alabama, are not integrated and not shared. So therefore, again, it falls back to the families to know when their child has been screened or evaluated and be able to share that information if they so choose. As part of the Watch Me Grow system, we do have a form where families can consent for us to notify their primary care provider. And if they do check that off, we do absolutely share that information with them. Funding for our system has been severely limited, and so that has created things to move rather slowly in New Hampshire. The successes that we've had, many child care providers are able to provide the Ages and Stages questionnaire and social emotional too. We often, if they choose to become a Watch Me Grow partner and they agree to put the information into the Welligent data system, we will provide them with those toolkits. Child Care Aware is also one of our partners, so we do provide training and technical assistance to child care providers for that. Primary care doctors are using some form of screening. They're not always using the Ages and Stages questionnaire. We just recently in the state of New Hampshire had renewed some MCO contracts and put specific language in there and specific subcategories to be able to track what types of screeners. So hopefully in the next few years we'll have a better handle on what screeners medical practitioners are using. Annually, at least 9,000 children are being screened across the state of New Hampshire. Families are learning about the milestones, and I think for me this is one of the biggest positive things that we've been able to use the Learn the Signs Act early materials for. The booklets, the app flyers to track them, and we also partner with Vroom so that when we're doing trainings and workshops that we have the families load not only the Milestone Matters app, but also the Vroom app. Referrals to family-centered early supports and services, preschool special education, and our family resource centers are constantly increasing. We partner very closely in our state. We were able to put into our comprehensive family support contracts that they are the hubs for our developmental screenings, so they're regionally located throughout the state of New Hampshire. Partnerships and collaborative efforts across the state are occurring, and we have an endowment for health that has funded some regional initiatives for early childhood, and they have also embedded developmental screening within that and created their own best practice guide for them to share with each other and mentor each other in how to provide developmental screening across the state of New Hampshire. Last August, Special Medical Services was designated as the lead on the project, as we are the agency that holds the Title V block grant. The benefit to that is that I'm able to facilitate the steering committee meetings. I'm also the Learn the Signs Act Early Ambassador, and I do majority of the systems work for early childhood. That includes family-centered early supports and services and working with children with special and chronic health conditions. The ultimate goal of our steering committee is to really take charge and drive developmental screening forward with the various agencies that are involved, as well as we are looking at the next stage of the Preschool Development Grant when it gets to the implementation phase, that we're hoping that they will be able to fund us to become a Help Me Grow state. And that is a recent change that has just occurred. New Hampshire's developmental screening system creates those partnerships within the regions, and then the regions keep things very local. So the state isn't telling them how to provide developmental screening. We do suggest that they use the Ages and Status questionnaire and the social emotional questionnaire. We do provide technical assistance and support as needed. We also have the data system that they're able to utilize and pull their own reports on. And so the Preschool Development Grant is able to kind of help us look at what are our future needs and how can we provide a more integrated system that will include things such as Alabama had with looking at providing access to schools, to medical practitioners, but it will be a process. One of the things that we are finding to be a little bit more challenging, we had quarterly reports that the Family Resource Centers would fill out that would report to us what were their successes, what were their challenges, what materials were they utilizing, and we have since expanded that quarterly report to go out to all partners, not just the Comprehensive Family Resource Centers. It's a request that we make, as the Comprehensive Family Resource Centers have it in their contract that they must complete this. We've invited all the other partners so we can really get a full perspective of the entire system. With private insurance companies, because we don't have it embedded into, we don't have contracts with private insurance companies, so we weren't able to understand when they bill for EPTSD, what tools are they utilizing. So that's something that we just need to kind of keep an eye out for as we're moving forward and providing support with our needs that are being told to us from this preschool development needs assessment. Some of the reportable requirements, the Watch Me Grow Steering Committee is really looking at what questions do we have about developmental screening? How are we going to get those questions answered? Does our data system support that? Are there other data systems that might be better utilized? We also look to make sure that the questions are identified in the quarterly survey. And this year was the first year that we were able to pull a one-page infographic of data for 2018 for professionals and families for Watch Me Grow. The Spark New Hampshire Governor Appointed Council on Early Childhood has a task force to identify and make recommendations to our early childhood system. We have had ongoing conversations for the past several years regarding data integration. New Hampshire has the third largest legislative body under the Parliament, so it's very hard to get legislation and rules passed. We're also live free or die state, so therefore the integrated data system and sharing of information is a hot topic around here. So it's been a challenge as our political climate has changed a little bit. Now is the time to look at this integrated data system both internally and externally with contracted staff, as well as building that integrated data system that's going to connect with the Department of Education or the local level, the lead education systems and medical practitioners, so that we're able to share that information and deciding on what that information is going to look like. The Preschool Development Grant is really helping us to identify that. That data group is helping us to identify that. We've put together a group of individuals from various departments as well as an attorney from the department to look at any law or rule changes, and the IT people for the enterprise system that we have within our state. We have 36 various systems that we're working with, 70 sites that are reporting on developmental screening, and an unknown number of medical providers. Although I can give numbers through Medicaid about how many children, I don't necessarily know how many providers are actually doing the ongoing developmental screening for their children. Partnerships have really grown as we have been able to embed ourselves across the early childhood systems within our state and building those strong relationships with individual people that are in those positions, but also with their organizations, have been key to helping us to move things forward. And it helps that our governor's wife has a strong early childhood background and is really helping to support developmental screening and early childhood systems as a whole. The lessons that the state of New Hampshire has learned: funding continues to be an ongoing issue. Data integration is a challenge. We have multiple partnerships, and embedding developmental screening systems into those systems seems to make the most sense. It has been challenging to hold people accountable unless we have some kind of contract or binding agreement. So although they've chosen to be partners, they don't necessarily always put the data into the system. Chasing them down can be somewhat of a challenge. We have talked about changes that need to be made systematically. It took us 8 years to get to a point where we're able to expand the system beyond just screening and education and really focusing more on the referral, the follow-up, and then building systems around that. And it requires a lot of patience. So know that, we're all making a difference in families' lives. The data collection and the funding is a challenge, but more important is making sure that families are aware of what their children's milestones are, how to reach those milestones, where they can go for support, and how they're able to make sure that their child is growing and developing in a positive trajectory. So thank you for listening to the State of New Hampshire, and if you have any questions, please throw them in the chat box for us.
Hi, this is Laura from Texas, and I just wanted to speak a little bit. I'm actually the ambassador with Texas, and wanted to talk a bit about coming from a local perspective, and then following me, Cody Somerville will be talking about the state perspective, as he actually is with our education agency that's overseeing the PDG grant. So coming more from a local perspective, and I actually operate a Part C program within the state of Texas. It's a very large Part C program that serves about 4,200 children on any given day. Probably about 12,000 come through our program throughout the year. And so we kind of have a history with how we have started our developmental screening initiative and how it blends a bit in with the PDG grant at this point in time. With TEA, they have passed on some of the funding to the Part C entity at the state level, and then those funds are actually passed down to some of our local contractors to be able to utilize for working with child care providers on identifying children and providing some screening practices within child care. So screening is incorporated in the PDG grant. But giving a little bit of a history at a local level and where we're at with screening, and as I listen to the other states, we're getting lots of great ideas from them, because I feel like we are still at a place that we're beginning some initiatives. But we actually started our initiative at the local level as a project launch recipient. And within the project launch, of course, developmental screening was one of the key objectives. And so we did create within a local level an action plan focusing on screening, more universal developmental screening across our community. And as that developed, we incorporated that into some of our initiatives as a Pritzker community. We have received through the National League of Cities, we've been identified as a Pritzker County, and then also through the National League of Cities and the National Association of Counties. And then our state also has a Pritzker Prenatal to 3 initiative. And so screening is popping up in each of those initiatives. And we kind of took what we started with launch, which was a developmental screening initiative, and have built that into a developmental screening action plan that we have incorporated into each of those initiatives. And it really focused on incorporating the ASQ enterprise, assuring that we were supporting across sectors, so really looking at our early childhood system
and thinking about how do we support our healthcare systems, our home visiting programs, our child care systems, our schools in the process of screening. And as we started this over the last few years, this was prior to becoming an ambassador, we actually encountered some challenges as we began the system, and I believe that honestly what caused us to have some challenges is we went in more with the direction of developmental screening rather than monitoring and surveillance. And so as we have embarked a little bit more in the Learn the Signs Act early, and just this year we have become an affiliate of Help Me Grow, and kind of attached to those core components, really looked at it more from a view of developmental monitoring and surveillance, and then screening when it's appropriate. It's been a bit more well received within our communities. And so in each of those sectors, in our action plan, we've looked at what do healthcare environments need and how do we support them so that they're more effective in doing the developmental surveillance and screening that is already recommended through their practices. And so in visiting with our healthcare providers, we did look at data that had been that we had from one of our advocacy groups that actually looked at Medicaid data. And we recognized just in our own community that about 96% of children were showing up for at least one well-child visit during the year. Even though we know they should be going to more, they were showing up for at least one. But out of those 96%, only 52% were showing up as having been screened. So we went to our healthcare providers to identify, what were some of the reasons that perhaps that was happening. And to be quite honest, many of our healthcare providers were surprised by that data. They felt like that more children were being screened. So we have implemented some strategies in that arena to help support our healthcare providers, and we actually have incorporated as strategies under our screening initiative some evidence-based practices. So we brought in the Healthy Steps program and placed Healthy Steps specialists in 7 of our pediatric practices across 3 healthcare systems, really as a pilot to see if we provided that level of support within a healthcare practice, would that change the outcomes of screening? And we did that in one community that was pretty heavy in having pediatric practices. In a different community, we do not have as many pediatric practices, but we have 2 large birthing hospitals where the babies are not being well connected to a medical home. So in that community, we're right in the process of incorporating Family Connects as an evidence-based practice. And in each of these evidence-based practices, we're threading through each practice the ASQ and assuring that developmental screening, ASQ-SE and ASQ-3 are occurring throughout all of these strategies and using the ASQ enterprise. Likewise, in our child care environments, as we worked more closely with them, we identified in many of our child care environments that some screening maybe was happening, but the difficulty that they were encountering is when the screening occurred, it was difficult to have conversations with families. So again, as we changed our language a little bit more towards monitoring and celebrating milestones and talking about development all the time, the screening piece became a little bit more area that the child care providers were a bit more comfortable with. We've also tried to incorporate and are working currently on incorporating some mental health consultations to allow for a little bit more reflective practices in child care centers and incorporating the screening. And then with our Part C, with the funding that's coming through PDG and across the state, that funding actually went to the state entity, and they have made that available to contractors, local contractors, so that they can utilize that, and they've created a training that can be utilized by Part C providers going into child care centers to further support them as well. So I'm going to turn this over to Cody and let him talk a little bit more about from the state and what this has looked like.
Thanks, Laura. This is Cody Somerville with the Texas Education Agency, and I oversee our preschool development grant here in Texas. And we have been inspired by a lot of the local work that has happened around the state over the past few years, and are leveraging the work that has been started in communities to build out some statewide efforts around developmental screening. I'm just going to share briefly about 2 things that we have going on. The first is we have an existing platform in Texas called Act Early Texas that was started by a former Act Early ambassador. And Act Early Texas is a developmental screening platform that families and child care providers can use to complete the ASQ, ASQSE, and MCHAT on children. And there is some automatic referral features built in for Part C. It will also automatically send the results to your primary care provider if you have one and if you provide permissions to do so. But what we've realized is that the platform, while it has many great functionalities, there are additional functionalities that are needed to help better connect it to existing systems. And so that way, work being done in other communities can be connected, and that while there's data, the data won't be connected in the end, but through one platform, if we can make some tweaks to this platform, it'll allow at least data to be pulled from both platforms and better be put together, if you will. So we are working with the University of Texas Health Science Center on updating the Act Early Texas platform. The other thing that we are doing under PDG is a couple of ASQ TOTs. Through Project Launch, a few TOTs were done across the state, and there have been some other initiatives within other state agencies to increase the number of ASQ trainers. And so we are coordinating with everyone who has been doing TOTs to figure out where in the state we need to target next, and where are there areas where folks traditionally don't have access to these types of trainings. So we are doing one in South Texas and one up in the Panhandle, and we are allowing professionals across the mixed delivery system to attend. So we'll have folks who are administering childcare subsidies at the local level, folks who are part of Part C programs and part of school districts and Head Start grantees and home visiting providers attend those ASQ TOTs and then turnaround trainings in their community. So the Act Early Texas platform update and the ASQ TOTs are the two big areas that we are using our PDG funds to increase developmental screening around the state.
Okay, so this is Jim. Thank you so much, Julia, and the team you pulled together, Tish, Carmen, Jen, Laura, and Cody. What a valuable 60 minutes we just had, and some super information that you shared that's been happening in the States. I do also want to give, before we end today, a shout out to Maria Sinodi on the Atlas team for helping pull together this conversation today. Also, which I sometimes forget, but I'm not today, also a special shout out to Evelyn and Kesley for managing the Adobe platform behind the scenes, and Tina, our capable captioner. So we've captured the conversation today. Thank you so much for everyone. We do have a series of questions that are in the chat. We're likely, we're nearing the end of time today, so we won't get to that, but we will share these questions with Julia and her team, and we'll work to get some responses back to those of you who have posted those questions in the chat. If you do have some further questions concerning the Preschool Development Grant, on the screen you'll see an email address, PDG B-5TA@atlasresearch.us. We will get back to you if you post some questions in there. We'd also love to hear your feedback and suggestions on our communities of conversation today on developmental screening, and the survey link is on your screen. you can directly link to that survey and ask. We have just a very short number of questions. We hope you'll answer and give us some feedback. We know that developmental screening is an extremely valuable component to the early learning field and those community programs that connect with children and families. We appreciate very much CDC, Julia, and the team being on the line today and sharing some of those valuable resources that you're providing to those programs and families and children in your community. And hope that those of you who have been on the line will be able to access and connect with your own children and families using this very valuable asset. Thank you all very much for joining the conversation, and have a wonderful rest of the day.